All right, our viewer question today is which blood test should a vegan get regularly?
Oh my, there are certain blood parameters that you really do want to follow until you're absolutely sure that your diet meets all your needs. The most important one, of course, would be vitamin B12, as well as the two substances that go up if you're not getting enough vitamin B12. That's homocysteine and methylmalonic acid, known as MMA. So if you only had a couple of tests to do, get your B12 levels checked and your homocysteine and MMA levels. And of the two that I just mentioned, the homocysteine is probably the most important because that can directly damage the artery walls. After that, the blood test that I'd recommend would be your vitamin D level, because we all spend so much time inside and you want to keep your vitamin D level up over 30 nanograms per milliliter. So check your vitamin D level. And a basic blood count is important just to rule out any anemia or problems with your bone marrow. But realize that vegans often run slightly lower hemoglobin levels because their blood flows more easily. It's less viscous blood without all that saturated fat in it. And as the blood flows easier and delivers oxygen better, you need less of it. And so hemoglobin levels, which in the omnivore population are frequently up 14 grams or higher. Vegan folks, often I see hemoglobin levels around 12 grams or so, and that's not a big problem. As well as the fact that white blood cell counts that go up in infection in vegans as the years go by, their white blood cell counts tend to drift down lower, where the normal values are around 4,000 white cells per microliter. The vegans clearly run much lower than that very often. Why? Because all food, all meat comes from the slaughterhouse. And when the animals, and even grass-fed beef goes through the slaughterhouse, when the animals are eviscerated, the stomach contents flow all over the cutting surfaces there. So every steak and chop that leaves the slaughterhouse has a covering of gut bacteria, E. coli and Salmonella and Shigella on the surface. In the meat case at the supermarket, these bacteria die, and as their cell walls break apart, it turns into these nasty molecules called endotoxin. And endotoxin does lots of bad things in the body, clots your blood, suppresses your heart, releases histamine, but it also stimulates white blood cells to be released out into the bloodstream. And so the folks who eat meat are giving themselves a shot of endotoxin 2-3 times a day, and that cranks up their white blood count. So we accept as normal 4,500, 5,500, 6,500. That's all normal in the meat-eating population. But vegans aren't doing that to themselves. They don't eat endotoxin 2-3 times a day. And without preying their bone marrow constantly and repetitively with the endotoxin, the white blood cell counts drift down to 3,000, 2,800, 2,500. At least twice a year, I get a message or a call from a panicked vegan saying, my doctor wants to send me to a hematologist. He thinks I've got bone marrow failure because my white blood cell count is down at 2,600. And actually, that's not really a problem at all. As long as the person is not getting infections, skin abscesses, or whatever, your body is perfectly happy with that 2,500 white blood cell count. So do get your complete blood count. But if it comes back, if you're a long-time vegan and it comes back with a white count of 2,800, that's okay. Vegan normals are different than meat-eating normals in many parameters, and this is one of them. So check your white blood cell count, or you're in a part of a CBC, complete blood count, and your vitamin D, B12, and homocysteine. Those are the main ones that I suggest you get. So long answer, but an important factor that's often overlooked. I'm glad we got a chance to talk about it. Hi, everyone. Dr. Michael Klaper here, announcing our new format for our Q&A with Dr. K. Annie Hagen will be asking me one question that's been sent in by our viewers. So if you want to see if your question is getting answered, do join us for our Q&A with Dr. K right here. Hope to see you then.